Singapore has suffered the research, and now Japan and Korean are facing the research. So from their experiences, what kind of lesson and knowledge draw from by Malaysia?
So thank you for the question, and we look into our methodology in terms of implementation of MCO as well as CMCO. So now we have seen after more than 24 days, and we've seen the positive effect of CMCO, which means CMCO over the last couple of weeks that we have seen, we continue to have lower double-digit numbers, and involvement of Malaysians is only about 22%. So the compliance perhaps is social compliance and also social discipline among Malaysians as high as about 90%. This is what I have been told. But more importantly, that we are seeing the recovery phase rather than the peak or the exponential surge. So we hope that now is 1 week post Hari Raya, and we are still seeing today, for example, we only have 10 Malaysians that is positive. So that is actually a very encouraging and positive sign that we are seeing. And we hope that in the next 1 week we'll continue to see a lower double digit or even single digit, which means if that is so, on the 9th or even before the end of the CMCO, we perhaps will look into the whole implementation, and perhaps that we will open up more sectors, slowly but surely, but very cautiously opening up the sectors, and we monitor the situation. So sectors like social sectors, sports, and even we are looking at the education sectors. When education, we are looking into mainly the Form 5 and the Upper 6 because they are going for the exam. So priority will be given to them. So we are monitoring daily now, and we hope that this good trend that we are having can continue. But we did have a few spike of cases last couple of days, but they are involving the illegal immigrants, for example, and as well as foreign workers. So our issue now, we also need to focus on the foreign workers, for them to educate them, to make sure that they also comply to the SOP, meaning in terms of their housing, in terms of their accommodation, plus in their practice in terms of maintain a good personal hygiene, take all the precautionary measures in necessary. But we realize that because they are living in a very confined space and also a crowded space. So we are working with other ministries to see how best we can improve the work, the accommodation for them, and to have for them to practice social distancing. I think this is important for us to look into whether they are foreign workers or Malaysian, but both need to practice the SOP. So if we can adhere and comply to the SOP, rest assured, I think we can bring down the cases further. But we are not in the exit strategy yet. We are still under conditional movement control order. So we have not planned in terms of exit strategy like other countries. Maybe they are already exit, but we are strengthening and tightening our border control. That is number one. And once we can control the border, we are now addressing the local transmission. So we can control the local transmission and tighten our border, then perhaps we can control the overall cases in Malaysia. And more importantly, the strategy before we exit is to community empowerment, which means it's not the onus of Ministry of Health and government to do the enforcement all the time, but the responsibility is equally to the public. So the public now, the community, they have to protect themselves. They have to protect the family. They have to protect the community and the country. So I think this is the strategy, that this is the whole government and social society approach. Then I think if all of us come together, then perhaps we can break the chain of COVID infection in this country.